Hey everybody, talking a little bit more about recovering after surgery for Morton's neuroma. All of my patients are immediately weight bearing. Some will have a little bit of pain on weight bearing, but they're typically really good. Particularly when we're doing those minimally invasive sort of DTML transections, they're going to be able to work sitting immediately with their foot up, and I'm pretty persistent on this to make sure that there's less swelling and less concerns associated there. But most people will be able to get back into their standing work between 1 to 4 weeks, depending on the procedure that they're done. Obviously, the more minimally invasive at 1 week, or the more open neurectomy at 4 weeks there. Most people are going to be back into joggers pretty quickly, and for those that are undertaking that minimally invasive deep transverse metatarsal ligament transection, that's where you're going to be removing those dressings anywhere between sort of 3 to 4 up to 7 days, and that's when you're back in your jogger. We remove the Darko post-operative shoe, but for those that have had the neurectomy, it's a little bit more invasive. We're wanting to make sure that tissue heals, the swelling's not too much as we push through toe off in our shoes, and so it can take a little bit longer, through to about 4 weeks before we're back into our joggers. Now, getting back into walking for leisure and our sports, depending on the procedure, can take a little bit longer. Most people after our minimally invasive procedure are getting back into walking at least by about 2 weeks. And then increasing their activity from there. Those that have had Morton's neuroma can be anywhere between sort of a neurectomy, I should say, or removal of the nerve. Anyone that's had that procedure, it can be anywhere between sort of 4 to 8 weeks, depending on how well they've recovered after the procedure. Everyone's different. Some people will need a little bit of extra Panadol, a paracetamol, and some ibuprofen or other anti-inflammatory in the short term, but most people are pretty good and get back to their activities really quickly. Hopefully this has given you a little bit of further information about the recovery after surgery for Morton's neuroma. Please hit the subscribe button, have a bit of a look at some of our other videos, and otherwise we'll see you in the next session. Cheers.